Hello everyone, welcome back to the channel Women Health and Diet, where we talk about everything health related, especially geared towards women. If you haven't already, please subscribe to the channel and click the notification bell. Subscribing to the channel is very easy to do and it's free. When you subscribe to the channel, it will encourage and motivate us to continue to create wonderful content to share to the world. So let's begin. The topic for this video is your tongue. Your tongue is telling you something, and it might be a health warning. The hidden oracle inside your mouth. In the mirror, it's easy to ignore. That pink muscle in your mouth that helps you taste, speak, and chew. But what if I told you? Your tongue is more than just a tool. It's an oracle. Yes, you heard me right. It's an oracle. A messenger that speaks a language few of us are ever taught to understand. Every crack, bump, discoloration, or unusual texture isn't random. It's a code, a warning, a reflection of what's happening inside your body, deep inside your organs, your gut, your blood, your immune system. In Eastern medicine, the tongue is a sacred map, and in modern medicine, it's becoming a diagnostic frontier. Let's unlock it together, the language of a healthy tongue. Before we read the signs of disease, we must first know what normal looks like. A healthy tongue should be light pink in color, moist but not too wet, soft, flexible, and smooth, not swollen, not too dry, with a thin white coating, covered in tiny bumps, called papillae. When your tongue fits that description, your body is likely in balance, but once it strays, something deeper may be shifting. Let's break down the most common warning signs and what they may be trying to tell you. The white veil, signs of overgrowth or imbalance. If your tongue has developed a thick white coating, don't ignore it. It may be subtle, but it's significant. Oral thrush, a yeast infection caused by Candida albicans, often triggered by antibiotic use, corticosteroids, or immune dysfunction. This isn't just a mouth issue, it's a sign that your body's microbiome is out of harmony. Dehydration. When you don't drink enough water, dead cells and bacteria build up. Poor oral hygiene. Without brushing your tongue, residue can collect and become a breeding ground for bacteria. Smoking. Tobacco changes oral chemistry, often creating white or gray buildup. If the white coating peels away in patches, revealing red underneath, it could be leukoplakia, a precancerous condition that needs immediate attention. Red flags, when the tongue turns strawberry red. A bright red, almost inflamed tongue is your body turning up the heat. It could signal vitamin B12, iron, or folic acid deficiency. These nutrients are crucial for cellular regeneration and nerve function. A lack of them can cause your tongue to become smooth, swollen, and painful. Scarlet fever or Kawasaki disease, both rare but dangerous, especially in children. These infections can cause what's called a strawberry tongue. Geographic tongue. Patches on the surface of the tongue appear smooth and red with raised borders. While benign, it may indicate stress, allergies, or nutritional gaps. Red isn't always alarming, but it is always worth investigating. Fissured tongue. When the earth cracks. A tongue marked by deep grooves or cracks might look severe, but often it's not painful. Still, it speaks volumes. It can be inherited. It can be linked to chronic dehydration. It's been associated with Down syndrome, psoriasis, and Sjogren's syndrome, an autoimmune disorder. And if food gets trapped in those grooves, it can lead to bad breath and secondary infections. If your tongue is cracked and sore, it's not just cosmetic, it's biological. Pale, blue, or purple. Your blood is trying to talk. Color changes on the tongue are among the most important and most misunderstood warning signs. Pale tongue indicates anemia or blood deficiency, common in people with poor diets or heavy menstruation. It also hints at low energy, cold hands, and poor circulation. Blue or purple tongue signals a lack of oxygen in the blood, caused by heart conditions, lung problems, or chronic cold exposure. In traditional Chinese medicine, it also suggests qi stagnation or trapped emotional energy. These colors don't appear overnight. They're slow signals, but they're real. Black tongue, the dark overgrowth. Yes, it exists. And it's not as rare as you might think. When the papillae on your tongue don't shed properly, they elongate. Bacteria and food particles get trapped, leading to discoloration, usually black, brown, or even yellow. Triggers include smoking, drinking lots of coffee or tea, poor oral hygiene, certain antibiotics or medications. It might look alarming, but it's usually harmless and reversible. Still, it's your body saying, clean up your act. Burning tongue, the invisible pain. What if your tongue looks fine, but it hurts? This is burning mouth syndrome, and it's as frustrating as it sounds. A chronic burning, tingling, or scalded feeling, often without a clear cause. It can be tied to mealing menopause or hormonal changes, vitamin B deficiencies, anxiety or chronic stress, nerve damage, more than realities. It's your nervous system misfiring. A pain without a wound, a message from your body that the stress inside is now echoing in your mouth. The tongue map, your internal GPS. According to Eastern traditions, the tongue is a map of the body. Tip, der heart and lung center, stomach and spleen sides, liver and gallbladder back, Marn kidneys, bladder and intestines. If there's a red spot on the tip, your heart may be under emotional stress. If the center is swollen, your digestion may be inflamed. If the back is coated thickly, your colon or kidneys may be overburdened. In many ways, your tongue is a GPS for internal imbalance, but only if you know how to read the map. A call to listen. We listen to our phones, we listen to our bosses, we even listen to strangers online, but we rarely listen to our bodies. So tomorrow morning, before you brush your teeth, stick out your tongue, look closely, and ask it what it's been trying to say. Your tongue isn't being weird, it's being wise. It doesn't scream, but it does speak. The question is, are you finally ready to listen? So that concludes this video. So if you made it this far, that means you liked the video. So why not just like the video physically by clicking the like button? Don't forget to leave a comment down below. We would love to hear your thoughts. And as a reminder, don't forget to subscribe, like, and comment. Thank you for watching and have a great day.